Namaste everyone. Warm good evening. Welcome to the fourth season of PRAJNAVARIDHI series. So, as you all know, every year Panchajanya during your exams, we will be helping you out with conducting lecture series, by providing you written notes, by doing mentorship and all. So, this is one of our initiatives where we reach out people, where we reach out students and help in guiding them throughout the exams to help them achieve their goals by providing them the materials and the lecture series and whatever the students need. So welcome you all for the session, and I won't go into details of what Panchajanya do because you all have been following Panchajanya for more than 2 years now. So I'll just skip to the introducing our guest. So today we have Vaidya Manju Prasad sir with us, who is medical director of Vande Wellness India Group. It's a India USA company. Sir is also Ayurveda physician, wellness innovator, and a research enthusiast. Sir completed his BMS from Government Ayurveda Medical College, Mysore, then did his post graduation in Dravyaguna from Government Ayurveda Medical College, Bengaluru. Sir has over 6 years of clinical experience and deep commitment to promoting holistic health and wellness. And Sir is currently leading chain of wellness centers across India dedicated to transforming lives through personalized treatment plans, panchakarma therapies, and innovative wellness solutions. Sir is also a personal development coach, advisor for healthcare setup and pharma setups, and is an internationally recognized Ayurveda coach and a business development strategist. Sir has received numerous awards like Wellness Ambassador Awards and has his multiple publications throughout the Ayush sector among various journals and magazines. Sir has received Best Paper Awards for in many conferences, and Sir has authored a handbook titled Patya Patya to guide patients on healthy regimens during Ayush management. Apart from this, Sir is a regular guest speaker in various premier institutes, and today Sir has given an opportunity for us to host him on our platform. Sir, welcome to the session, sir, and it's our honor to host you on Panchajanya platform to help students in achieving their goals by guiding for their exams. Welcome to the session, sir.
Thank you, Dr. Karthik, and we're very grateful for calling me, and also uh, by knowing the background of Panchajanya itself is like it shows how you people are connecting in a good way. And I hope wishing you all the best and for all the future endeavors and all the programs too.
Thank you so much, sir. Thank you. Thank you for your words. So, can we start with the session, sir?
Yes. Hello students, first of all, I thank Panchajanya and his team, Kartik and his team for this wonderful platform. And today, as per the program, I have been asked to talk on Draviguna exam preparations. Okay, I hope you people are watching it live, and if you got any Q&A sessions, if you have got any questions, you can ping me back or you can ping Dr. Kartik. Okay, so I will not go in detail. Like now, already I got to know the dates of exam. It starts from 18th or 19th, and Raviguna exams on second exam for you. So considering the time gap we got, and we'll see how well we can work out. Okay, I think I'm audible and I'm clear. My slides are visible. I can move ahead,
Yes,
right?
sir. Sir, you are audible and visible.
So we're gonna and this topic goes essential strategies for success, as Dr. Kartik has presented uh, the background. So we'll go ahead. Let me open the slides in full scale. I think it's clear now. So, hello students. I'm sure, like as I said, I hope this is not a first session and you're not a first year students. You're on second year at the end of the second year, right? Like you have been went through the examinations, pre first year examinations, the preparation cycles, and everything. These things are not new to you. I mean, You all are aware of the upcoming exams and also you have cleared the previous exams, right? So how this session helps, how the Draviguna exam preparation session works, right? Here we'll not go in detail, like presently as I said, as we got very short period of time, I hope I have been covered the syllabus. As we generally say, we always follow multiple steps. The first step is early preparation, right? Since the day we joined the college, or since the day the curriculum starts, the early preparation starts. And I hope, considering the time and considering the exam timeline, by this time you have all been finished the early preparation part. Second part, organizing your space for study, right? So before we start any work, like we are usually we gather things, we gather notes, we gather textbooks, we gather other study materials, we gather ppts, and we'll make sure a good learning environment which can align with our learning goals. And step three, review and practice old exam paper. I think presently you people are doing this, right? I hope you are reviewing the old syllabus, you are reviewing your notes, and you are trying to practice or practicing or practiced. We got all three sets of students, right? So some might be already finished what working on old exam papers. Some might be thinking of starting to work on old exam papers, or somebody or somebody already in, right? Getting and back to old exam paper is one of the key point where we'll get an idea how things come, how question paper is developed, how well we can be prepared, right? These are the major three steps. Step one, as I said, early preparation. Step two, organizing your space. Step three, reviewing and practicing, or you can also say revising. Considering the 1.5 period of your curriculum, of second year curriculum, I hope by this time you have finished all these three steps. I just don't want to take you backwards and bore the sessions. Directly, I'll enter the final step after 12 steps. And if we are about to go to exam, like in coming days, in couple of weeks, then how we should prepare, like that. The whole today's sessions or program is divided into three sectors. One is we'll be working on what to know, then we'll be working on how to know, right? Third point, so how to write, what to know, how to know, and how to express. So these are the three sectors, or it's the three themes today I'm going to talk about, and I hope this may help you in your preparation. So that's what the rule of this session is. The rule and the main goal of this session is, I'll take this for 40 to 45 minutes. We'll divide the thing. We'll take first section for understanding the syllabus, because before going to any work, we should know the background. So where is the battlefield, with whom we are fighting, or with whom we are what into coming up with associations, or with whom we want to deal with. So understanding the syllabus is the key point. These are the first point. Without understanding the syllabus, I hope it's very difficult. Only relying on the revision notes, only relying on the old year exam paper doesn't work unless you know the battlefield. The battlefield is been clearly described in syllabus, which are the LAQs, which are the SAQs, long answered questions or short answered questions, where the multiple choice questions, the sections we'll get to know, right? We should definitely thank NCSM and the Ministry of Ayush for bringing up a very beautifully sorted and technically sound syllabus. And I really like wish even this type of syllabus would have been come earlier, so that we would also be exposed more. But it's good that ministry is coming with good things, and our research centers, research organizations are coming with best quality of teaching. And now we got a good syllabus where it's so clear, things to must to know, desirable to know, and other parts. Okay, come as I said, first part, what to know, that is what understand the syllabus. Second part, how to know things. Like preparation parts takes a takes us to a right junction. If our preparation is not at a good phase, we can't reach the destination. So preparation also most important with respect to right preparations. All preparation may not be right. All preparation may not be wrong. So right preparation will take you to the destination in a faster way. So next, now we have understood the battlefield. Now we are preparing well. What next? And we have prepared well. And what next? Next, entering the examinations. You're fighting with other soldiers or describing or taking the things out of our mind and expressing in paper. So that's what examination is. Planning before writing. You always know, right? Think before it. Most of you have heard about the word think before it. So today's session is going to happen in three sections. First part, understanding the syllabus. Second part, practice, practicing techniques. And last part, how to face examinations or how to write examination in a skillful way. Now, going forward, we'll take the first sections. Are you ready, guys? I hope you guys are ready. So the first part, like syllabus, like as I said, understanding a syllabus means first we should have a syllabus, right? I hope most of you have come across syllabus. If not, you should go now. Let me open the syllabus. Just a minute. Yes, the syllabus is ready. So I hope you can see the syllabus in the screen. So Dravyaguna Vignana, subject code IUGDT, right? So what exactly we should know? I hope most of you have got are well aware of syllabus, well aware of curriculum activities listed in syllabus. But before going to exam, how to view the syllabus, how to understand the syllabus, and how to plan our practice. Right? We come to the page number. Yes. Before that, before going to page 9, where it concept of courses, I will take to regarding questions where the pattern has been described. See, yes, I think you can see the marks distributions and also the concepts, the part where they will pick the questions, right? Here we got three sections: one beta, C marks, MCQs, SAQs, and LAQs. In brief, this chart, these tables helps us to understand from which portions what type of questions will come, right? If we say first question say Dravyaguna Vignana, we can say MCQ questions can be taken from that part and it show from Dravyaguna Vignana concept or from the Dravyaguna Vignana chapter, we won't be having any short answer questions or long answer questions or the questions for 5 marks or 10 marks. It's clear. So what does it make to make us to understand means no need to worry on that, no need to completely deeply study on that. Just we need to understand the concept of Dravyaguna Vignana based on its marks distribution. And before going to in completing the marks distributions, also we'll share a disclaimer. This session is we are conducting this session or the explanations, we are descriptions we are giving with all are with respect to the time gap you got, right? You got only 20 days, 15 to 20 days or 25 days gap. Considering the time gap, we are preparing based on the marks. But apart from this, I always advise the students to always go in depth knowledge, regardless of marks. Whether the Dravyaguna Vignana concept may come for 1 marks, 5 marks, 10 marks, all Dravyaguna graduates, all second year UG graduates should have good or sound knowledge of complete concepts, not merely on marks distribution. But in this today's scenario, in this today's sessions, we are working on exam preparation. That's the reason we are considering the marks and segregating our practicing techniques. Okay. So second part, you can say, I will not like to go in detail. You can see I have marked SAQs. Like from all the concepts, from all the 28 concepts you got, MCQs. From all 28 to plus chapters or sections, MCQs can be asked. But the good thing is, they have clearly said, the syllabus clearly says only particular branches or particular chapters or particular sections where we can expect long answers questions and short answers questions. The one part is, you can see the yellow marked, which are visible in the tables, like Dravya. If you read the concept of Dravya, only you can expect 5 marks questions, not the 10 marks questions. Considering the examination orientation, an examination view, you can make sure you can remember certain data or certain information which are sufficient for 5 marks. Okay, no need to stretch it for 10 marks. But in case of Guna, the third point, you can see there is no option for SAQs. It means there's a 100% chance or highest chance of getting a 10 marks questions, which means you have to know Guna in detail. It means whatever the point they may ask, whatever the question comes, whatever the subcategory comes, you should be able to understand the Guna concept and bring out the essence with clinical applications and research updates with respect to Guna whenever they ask for 10 marks questions. Similarly, Rasa. So, similar way we can see all yellow mark questions are with SAQs, where at this point of time, considering that exam timeline, you can make sure at least you should not have information which is less than 3 page or less than 4 page understanding, which are not capable of bringing that concept in paper for 4 pages. So make sure you got enough or sufficient knowledge. But with respect to red marks or a pink mark, you can see in screen, karma comes for LAQs, 10 marks questions. It means the concept is more important and your understanding of concept is also much more higher. So you should make sure you are capable. You understand the concept of karma in such a way that you can write the answers in either 5 marks questions or 10 marks question or MCQs. So in karmas, you really need a deep understanding. Okay, it's not that merely or superficial knowledge of things doesn't work here. Similarly, Karmas of Dashamani, SAQs, Principle of General Pharmacology. It's one concept, one beautiful concept where my favorite concept, general pharmacology, where you will be exposed to actual mechanism of drug action, how drug act, PK, PD, pharmacokinetics, pharmacodynamics, dosage forms, parental routes of administration, so many things, right? This is a very interesting part, the must thing to know to an upcoming doctor. So this is one concept where this principle of general pharmacology sections invites the questions from all the sections, either MCQs questions, SAQs, or LAQs. Similarly, the main concept is after, if you see after 13th or 13th number, serial number, you can see only nomenclature of Dravya as per Ningat to Prashasta Beshija Dravya Sangana, they are eligible for, they will invite only MCQ questions. Yeah? So it means it won't, there are less chances. We can't say it won't come, right? Ultimately, the person who does paper, they does brings up the questions, brings up the, like, it can be direct questions, it can be indirect questions, or it can be twisted questions. So considering the exam point of view, at this point of time, you can make sure a good knowledge is enough for the post 13 serial concept, 13 14. So it doesn't short answers or long answers will not come from these sections. A bit relief kind, but it's not that these concepts are not important. It's also important, but don't forget to work on the really LAQs and SAQs. And they also, similarly in paper 2 also, it's almost full. There's not much to segregate. Coming for next sections, they already made our job easier. The second part, Q2 part, that's it. These are the short answers questions where we get 8 questions from these sections. Either it can be Dravya, it can be Vipaka, it can be Virya, Prabhava, Karma Sabdashamani, principle of general pharmacology, it can be another principle of general pharmacology or Mishra Kakana. These are the must sections. Whenever before going to exam, before during your preparation, you should make sure you prepare in such a way that you are capable of answering, you are capable of expressing your knowledge for in 3 to 4 page. Okay? Knowledge expressing language, you should always make sure the qualitative expression, not the quantitative expression. It's not that I will write 4 pages or I will write 5 pages, I will get marks. No, there should be a quality. There must be a quality. Only quality answers will attract marks. The only filling the pages with nonsense things, only filling the pages with repeated things will definitely makes you lose the marks for the better questions also. So similarly, these are the 4 sections. The must sections, Guna, Rasa, Karma, and General Pharmacology. You must be prepared in such a way that you can write the text, you can write the describe or express the concept for either 5 marks, 10 marks, even for more marks. Doesn't make we can also get from the same concept from Karma concept. You may get 10 marks questions, you may get 5 marks question, and also you may get MCQ, multiple MCQs. Right? So don't neglect any questions, but make sure considering the importance, considering the SAQs, LAQs for Guna Rasa Karma, you should be able to gather the information sufficient for 10 marks, and for Dravya to Mr. Gagana, should make sure you have enough information which can fulfill the 5 marks. Okay, this is all about a quick bird view for the syllabus marks distributions. Coming for sections wise, like during the preparations, we have to prepare. Okay, because and without understanding the syllabus, without reading the syllabus fully, it's very difficult. Reading the syllabus will make sure the whole concept, the whole journey easier. It's not respect to Dravaguna only. You can also apply the same knowledge, the reading the syllabus for all the subjects. This will make your the further journey easier. Okay. So if you coming for Draviguna Vignana, we got to know, we understand. So we'll get only 1 marks with respect to what MCQs. 1 marks question is MCQs. This means you should have a super view. Super view or superficial view is enough, right? Make sure you cover superficial view means you should cover all 365 degrees, right? You no need to buy at that, okay? But make sure you understand the concept, don't fail, because you can't buy 10 pages or 15 pages of information for 1 marks. Okay, even you got 99 marks too, the rest 99 marks. So make sure you understand the concept beautifully, so you don't need to buy hard things. Okay, but just by understanding you can work on MCQs. Coming for Dravya here, like what kind of questions you may get. See, and as I said, without understanding, without analyzing the syllabus, it's very difficult to go to the third part. Or it's very difficult to go to the preparation part, the second part. So by understanding, by reading the syllabus, by understanding, analyzing the syllabus, we can make sure at which part I should work on, at which part I should practice, where my practice should be focused, right? If coming for Dravya, the second concept of Dravya, it shows you got six marks, 6 marks are allotted. We can split into 1 for MCQs, 5 for short answers, right? Short answer questions. So it means in a question paper, in an answer sheet, you will be allotted 3 pages, right? 3 pages. You will be given 3 pages for 1 questions. So make sure whenever you are preparing for a concept of Dravya, reading the concept of Dravya or revising the concept of Dravya, make sure the analyzing the point. The point says Pancha Bhautikatva of Dravya. One part. Second, classification of Dravya based on Utpatti Veda, Yoni Veda, Prayoga Veda, Prabhava Veda, Doshagna Veda, and Rasa Veda, and Karma Veda. Right? There's so many Vedas, right? But make sure whenever you are reading Panchabhotikatva of Dravya, you have a good understanding, and you can able to, you are capable of expressing the same information in a qualitative way in 3 to 4 pages. Okay. Whenever you're preparing the notes, whenever you're revising, after reading, make sure you can recall, make sure you can improve the words, improve the sentences, improve the paragraphs, or involve some correlations which are capable of completing within 3 to 4 pages. So coming to classification of the rub, you also can say there's so many bit of 1, 2, 3, 4, 5, 6. Make sure whenever if you're preparing, in the preparation phase itself, whenever they talk about classification of Dravya, make sure you put a table. Okay, just don't go directly if they ask extend the classification of Veda with respect to Utpatti Veda, Yoni Veda, Rasa Veda. Don't do, you will directly jump to Utpatti Veda or Yoni or XYZ Veda. Make sure you explain what is Dravya, what you meant by classification of Dravya, and make sure you know the table. Table means just do the flow chart. The Dravya based on Utpatti Veda, Dravya based on Yoni, Jaraja, Andaja, so many things. Prayoga based on Dosha Shamana, Doshahara, Dosha Prakopaka, Prabhava Veda, Doshagna Veda, Vatara, Kafara, Vata Shamana, Kafara, Rasa Veda, Madura, Amla, Lavana. So even though you don't write in detail, make sure the second line after the definition should be a general classifications. Okay, it shows that there's a less chance of asking all the Vedas, as there is only 5 marks dedicated. You can't expect to get an answer, but the questions which ask you to explain all the Veda. But make sure whatever, whether they ask Utpatti Veda, whether they ask Rasa Veda or Karma Veda, make sure you put one general classification table. Okay, the general classification table will assure the evaluator, assure the person who is evaluating the paper, make sure, oh, this person or this student have a good knowledge. Okay, you will get 50% of marks, assured in evaluator mind. Okay, just because with one simple table, that cumulative table, the holistic table will make the evaluator, the person who is evaluating, to understand, oh, this student has a good knowledge, so no need to go in deep. Definitely he will be explaining further, so this gives a guarantee marks. Okay, guarantee a good marks. Not only with classification of Raman, any concept, make sure you bring flowchart, make sure you bring diagrams, make sure you bring tables. That itself will attract the marks. Similarly with guna, panchabhotikatva guna, characteristics of classification, guruvadi guna, karma, dosha, dhatu, mala. So it's come, we got guruvadi guna, right? We all know. I will leave a question to you. Just revise, just recall how many guruvadi guna we got. Okay. So you got one number in your mind. Just make sure to write, if you write Guru Guna, Lagu Guna, make sure you have 4 arrow marks. Dosha, Dhatu, Mala. What does that particular guna does to dosha? Whether that guna downs the dosha, decreases the dosha, elevates the dosha, or increases or agitate the doshas. Similarly, whether it is dhatu vardaka, dhatu kshayakara. Similarly, whether it is malakara or malahara. Just keep the answers in very fundamental way. No need to work on, no need to by heart complicated words. If you know Vata Pitta Kapha, you know Sapta Dhatu, you know Trimala, right? That basic concept is strong in your mind. Make sure you bring all this basic concept and finish the questions. So, for especially, and I said in Guna is one of the must questions for LAQs, right? So, whenever there is a long answer question, you should make sure you bring up all clinical applications and research updates. I will let you know how to write that. Similarly, Paradiguna with examples and clinical application research. It's one of the important questions. This question may appear in coming, may appear. I can't say it will 100% appear, but this Paradiguna questions concept has got high value, high profile, which can capable of coming in upcoming exam. Please, if you're not into Paradiguna, please read all the Paradiguna. You know, right? There are 10 numbers, right? And that is the one guna which always got more significance in clinical practice. Similarly, by understanding the marks, Guna, Dravya, classification, just an examples, just to make sure how to prepare, right? Whenever you're preparing the notes, how to prepare. Because there is no sense if you can prepare notes for Gurvari Guna for 3 pages and make 5 pages or 6 pages of notes for Dravagana Vijnana. So, considering the mark distribution, make sure you prepare the notes. Right? This is a brief introduction on how to prepare with respect to the syllabus points and its marks distribution. I hope this is clear. Okay. The first point, understanding the syllabus point or understanding the information in the syllabus is clear for now. Shall we move to second part? Right, as I said, first part we should always know what to know, and we are knowing what's in the syllabus and how to know, and we understand the mark distributions and practicing, right? The second part is practicing. So we'll go to this part. I hope my screens are syllabus. We just completed a part one, understanding the syllabus, analyzing it based on the marks distributions and the concept. The second part, the right preparations. Everybody do preparations, right? You people are already doing the preparations. You're already been prepared for previous exams, previous intervals, right? So what is right preparation? Well, then the question arises, will there be right or wrong in the preparations? Definitely. A right preparation will save your time, will save your memory, and make you calm. A preparation without a goal, a preparation without a right mindset, or a preparation without a proper planning will always comes with a word that is called stress. Yes, sir, I work hard. I always read. I usually read 2 to 3 hours in a day. But still, I forget. When before exams, I will forget everything, right? Most of us have suffered the same or have been through the same situation. Even though we are a good hard workers, and you people are good hard workers, at right point you can't recall the subject. At right point you can't replicate or express what you have learned. So most in our lifetime, most of us have been through, most of us have corrected, some of them are still struggling, and some sort of people are still trying to understand to whether the things they are doing is right or wrong. They're in the still same phase. Okay. So I assure only right preparation can take you to a right destination in a much faster way. Okay. Let's go to right preparation. This preparation with respect to timeline of the examinations. Right? As I said, it's always three types of reading during the beginning of curriculum, where we focus more on understanding the concept, right? Where we don't need to buy hard things because there will be no exam tomorrow. In the beginning of curriculum or beginning of academic year, we should always give more focus on understanding the concept, correlating the concept. The second part is after understanding the concept, after multiple concept, you should make sure you can correlate between chapters. You should make sure you can correlate between the environment and that chapter. You should make sure you can correlate between that day-to-day life activities. So after correlation only, you can make sure the memory retention will be more stronger and deeper. Just by reading you can't retain memory for longer durations. Make sure you read, understand, correlate, and come up with your new what new thoughts or new proposals or new principles, right? New philosophies. You can come up with your own philosophies. So the first part is review, right? By this time, oh, you all are finished the concept, whether you know, whether it is by hearted, whether you can remember, recall, replicate, that's not at all important. But it's been since from the journey of 1.5 year past the journey of 1.5 years or 18 months or 13 to 15 months, you might have come across the syllabus, you might have come across the concept, you might have come across the information. Now it's time for reviewing, right? Then we are revisiting the chapters. Okay. Then revising. There's a difference between reviewing and revising. Then the concepts are can be revised further in a correlational way or in a with adding with examples. Make sure it is less burden to remember, less burden to recall. We may not need to start with the first word to remember the whole paragraphs. That is not revised. Okay, that's not review. So yes, sir, I can recall all the lines, I can recall all the shlokas, or I can recall whole paragraph, whole chapter. Only thing is I missed the first line. If somebody can help me with first line, I can complete the paragraph. That is not a good revision. Always make sure you bring up a good story. Always make sure you bring up good examples. Always you make sure you bring good scenarios to understand the concept. Then only the revision is complete. With scenarios, with examples, the memory will be retained in deeper tissues. So it can be expressed, recall, remember in easy way. So, so what? How to remember all this? Like now we got exams, right? Anyway, we are not done properly. We are not going through the syllabus properly. We were not focused enough. Now it's time. Okay, how to do that? Right? We got the second part to do that. The helper who can help us in revising, reviewing is notes preparation. Yes, you heard me right. It's notes preparations. Because you may say, sir, I'm already near to exams. Like already I got only 20 days or 15 days. Even if I give 3 days a subject, it's not enough for me. And you're telling me to prepare a notes, right? But students, with my personal experience and with my personal guidance, and guiding. Notes will always help you. Preparing your own notes. Not need already one of your friend have prepared the notes, so you will get it Xerox or you'll get the photocopies and read definitely not. Or you'll get the online notes from websites from other teachers and I will go through their notes. That doesn't work. It makes you more stress. It gives more burden to your brain. Always make sure what exactly notes. What if we go for a notes? What do we do in notes? Do we exactly copy the lines in the textbooks? Definitely not, right? We'll try to cut short the lines, right? If the paragraph is 4 pages, we'll make sure we'll bring 1 to 2 lines in our notes. So what we are doing, we are revising, right? We are revising after reviewing the paragraphs. That's what your notes is a good revise sections, revise portions, or revise content. So always make sure you are never late. You are never late to for notes preparations. Only self-written notes, self-prepared notes will help you in your exams. Just if you want to what focus, if you want to retain, if you want to depend on other notes, make sure always read, mug up by heart. But if you prepare your own notes, 50% of the job will be done by yourself. So the 50% of the concept will be in your head. So the stress of recalling, remembering will be less. You can easily remember, easily recall because you have been read that, you have understood that, and you've written the notes in your language, in the simple language, the language you understand in a systematic way. So make sure if you're feeling difficult in understanding the concept, if you're feeling, sir, every time I read Guna, every time I read Pancha Bhautikatva, or every time I read Prabhava, or every time it will be Vipaka for general pharmacology, always I forget because the textbook knowledge is of vast 5 pages, 10 pages. You can't always bug up and you can't recall, replicate all the sections, all the paragraphs. That's why if you prepare the notes, it will be easier for you. So it's also one of the technique, right? There can be detailed notes for understanding purpose. There can be short notes. So now, as exams are near, we'll make sure how to deal with the second part, a short note. And we are preparing a note such that which that notes should help us. That note should not be another textbook. Should also make sure that. So note doesn't mean copying everything and pasting it. the notebook from textbook. No, note should be simple. Note should be a simple language. Note should be not too much descriptive. Okay, it also make sure you can finish the notes within. We can finish the concept of 5 to 6 page within 2 pages. So if you're coming for notes preparations, make sure as the exam pattern you get 50 pages, and you will be having as 5 to 6 pages for long answered questions, 3 pages, 3 to 4 pages for short answer question, and of course MCQ you may just need 2 lines. So at this point of time, if you're not prepared notes, or if your notes are longer, if your notes are what more, if you got more knowledge and more information, make sure you revise that notes, so that whenever you are working on the making a notes on guna, karma, rasa, and other general pharmacology, those are the LAQs questions, right? Sections, right? Rasa, guna, karma, general pharmacology. Make sure while preparing the notes itself, the notes should be made in such a that this is one of your answer booklet which are issued in your examination of. So the long answer question should be right minimum 5 to 6 page of notes. It should replicate how you will present the information in examination answer booklet. It's not that you will read book textbook for 5 to 8 pages. You can revise at that point in time. Even you got notes, you got 7, 8 pages of notes. But at the exam, you got only 6 pages are allotted for LAQs, right? So only 3 pages are allocated for short answer questions. There is no use of reading. There's no much use of covering the concepts for 8 to 10 pages, and again struggling in examination all for cut shorting, right? That also makes stress, brings stress to you. So there are some particular questions where like your favorite questions, you'll get the favorite questions, you have read all the rasas, very good. But the question was very subjective, limited. But you will be keep on writing the rasas. Yes, yes, I know. I have prepared the notes for 8 pages, and I can easily recall all the 8 pages, and you start it. Start to write all the things. By the time you reach 4 pages, or by the time you meet 50% of the concept, by that time you would have finished fifth or 6 pages. There is no much page left to answer. You may be knowing the details, you may know the answer, but the extra unwanted information will consume your pages. So that should not happen. So if there is a shortage of pages in space for one question, the same will repeat for further questions. So we make sure during the preparation of notes itself, make sure the long answer question notes, the section should always be in 5 to 6 page. The short answer question notes, if you're working on guna, dravya, if you're working on vipaka, make sure the vipaka section notes, any concept taken from vipaka should be within 5 pages or within 3 pages. Any concept bringing up with karma, general pharmacology, will be within 4 to 5 pages. This will definitely help. And here I have given a small sections how to write in notes. Right? As I said, notes should not be another textbook. Right? Note should not be another textbook. Note should be a like one book which you can easily carry, which can with a simple class, it should be able to help you to give overall information. Whenever you are preparing to make a note, we are ready to make a note, prepare a note for long answer questions, make sure all the components, all the points displayed in the slides should be there, right? It also replicates in exams too. If you got 10 marks questions, these are the systematic presentations of such answers. One, make sure you write introduction, one paragraph, 3 to 4 lines. It depends on your interest. And whenever there is a question for long answered questions, so during notes or writing or in examination part, that's what time. Make sure you don't forget definitions. Whatever they ask, if they ask guna, if they ask directly Guruvari guna, if they ask directly Paradi guna, make sure you write the definition of first guna. Okay, then first, because always you should write the background. If you start with the background, that make sure you have enough knowledge, and also it keeps the evaluator in a track that this person or this student is already got a good knowledge, right? It goes easily. So always don't complicate. Make sure you always start with definitions, then classification. As I said, if they directly go, if they ask Paradi Guna, if they ask Sharira Guna, if there was other gunas, Gurvadi Guna, make sure whatever guna they ask, if there are questions for 10 marks, mention the definition of guna and just mention a classification of guna. What are the types of guna, what are the sub classification? No need to go for sub classification if the question is very specific, but make sure you mention at least general classifications. Okay, then come to the subject matter, what they ask. If they ask particularly of paradiguna, then you can go for parapara, right? If you ask for guruvadiguna, guru lagu shita. If they ask for Sharika Guna, if they ask for other sections, you can go in detail. Okay, the third part should be detail, and make sure the third part, the matter, the content, the subjective content, focus content with respect to questions only. If the question is something, if the question is a guna, if the question is a rasa with respect to madhura rasa, there is no use if you talk on all other rasas, right? If they're particularly asked, define rasa, define classification of rasa, karmas of rasa of madhura amla lavana, but if you start writing katu tikta kashaya, there is no use. If they ask, give a complete details of rasa with respect to madhura, then you should make sure you give the definition of rasa, classification of rasa. Then coming to madhura rasa is guna karma, what is ati yoga, and when or it can be used, how madhura rasa can be helpful in clinical applications. Before clinical application, with respect to matter, you can see it under matter, you can see tables, you can see flowcharts, you can see diagrams. Make sure try to put tables, flowchart, diagram as many as possible. If coming for Rasopalabdi, you know is Rasopalabdi, always make sure you draw olfactory related organs, pathways. It's a simple pathway, right? So what does flowchart means, right? Flowchart is nothing but just mention the main point, main word, give one arrow mark downward, sideways, and write the next point. These are the highlights of your answer booklets or the answer papers, where which makes evaluator to understand you are good enough. Your answer paper is good enough, give a good marks. So it doesn't mean to get a good mark. It doesn't mean you have to write all 100% of your knowledge. You have to bring all the 100% of the textual knowledge. Make sure a good presentations with a good or enough fair knowledge can attract a good marks. Even if you have a very good knowledge, a very good memory power, but if you're poor in presentation, definitely you can't get more marks. So these are the highlights, star marks. That's why there's star in the slides. Definition, tables, flowchart, diagrams are the star points, star markers. This table, flowchart, diagrams with respect to any questions, and make sure you bring table, flowchart, diagram with respect to question they are asked. Don't bring unrelated uh, question or tables, right? This will make sure you'll get a, you have already have good knowledge and you can capable of getting a good marks. This is we are talking about long answer questions. So now we've finished the background introduction. We come up with basic definition. We start with classification, and we enter the core, where we, with the help of table, flowchart, diagram, we express the thought. We answer. What next? Will this be sufficient? Definitely not. Make sure for long answered questions, clinical applications and research updates are the must thing. Without clinical applications and research updates, your long answered question will never get completed. So for everything, whether you read guna, whether you read karma, whether you read vipaka, virya, prabhava, make sure you know at least one clinical applications. So what does it mean clinical applications? Rasa. If you talk about Madhura Rasa, what is the clinical application of Madhura Rasa? What does Madhura Rasa does? Madhura Rasa is Pushtya. Madhura Rasa is Tarpaka, right? It nourishes the body. How can we correlate the clinical application? No need to go for I and just think Madhura Rasa, it makes us gain weight, right? It nourishes body. So clinical application means where can we include this Madhura Rasa? The person who is lean, we can give Madhura Rasa because it's Tarpaka. The person who got Suffering from weakness, we can give Mother Rasa. That is self clinical application. That's the problem. You are bringing a clinical problem and giving the solution with respect to components. Another clinical application you also know Doshaknata, right? Madhura, what does Madhura Rasa does? Madhura Rasa does Vata Ara, Kapha Kara. It increases Kapha and decreases Vata. So in Vataja conditions, the person is suffering from Vataja diseases. You all know what can water disease it is related to pain, right? In such condition, Madhura Dravya will work, right? So Kafakara, also Madhura Rasa is Kafakara. The person is coming come from Kafakara disorders. If it's coming from Avarana disorders, make sure you avoid Madhura Rasa Dravya. Whenever there is a nourishment, the need of nourishment, use uh, Madura, and whenever this, you don't need nourishment, you use Katutikta Kashaya. And the best example for Tikta is Jwaragna, right? If your expert question is of Tikta, then you can, a clinical application of Tikta Rasa is Jwaragna. It's antipyretic in actions, antipyretic in nature. It reduces fever and also is Amapachak. Tiksarasa is Amapachaka. Deepaka as well as Amapachaka. This is for clinical applications. If you're coming for Guna, that also we have to write clinical application. If you're coming for Rasa, Vipaka, Virya. For Pitta Prakriti people, should always give medicines of Shita Virya drugs. Right? For Shita Prakriti people, should always make sure we give Ushna Kara drugs. So these are a simple clinical application. No need to buy it complex disorders. No need to buy it complex systems. Make sure you keep your answers in a fundamental and basic way. But the presentation matters. Okay. If no one is testing the student whether he got more knowledge on system, whether he got more knowledge on cancer, whether he got more knowledge on diabetic. Just may just want to know whether the student has understood the basic concept or not, whether the student can bring the understanding of concept in a clinical application way, whether it can apply in day-to-day practice. That is what we are looking in evaluation. So for long answer question, along with clinical application, make sure research updates. Okay, here's the trick. I just want to showcase with you, what share with you all. Okay, research updates, sir. Like in say, sir, no, sir. Like already there is so much of burden for us. Already there is a hectic schedule, more content to read, right? And we don't have much time to read research aspect, and also we don't understand. Also, we are in a early period of our academics, and we are not into research, or we are not completely oriented to research how to answer that, but it's already difficult to buy it and recall remember these things. How can you tell us to add research also? What can be done in these questions? This is a small trick. I will let you know. If you make sure you will not tell to others. Okay, will you promise me that you don't share to others? Okay, this is open secret, right? See, research updates. To write a research updates, you should know three concepts. Okay, you should be good enough to know three concepts. Okay, we talk about one drug. If you're talking about Vasa, you know Vasa, right? Aratora Vasika, right? You know, if you want to talk about Vasa, but I have not heard, but I have not referred any research paper, how to write a research update, right? Vasa. What the main action of Vasa? Rakta Pittagna. Right? Vasa is a drug of choice for Rakta Pittagna. Hemorrhagic conditions. Also, Vasa is also good for Kasa. For cough. For respiratory conditions, Vasa is a good drug. Right? So, how to deal with that? How to combine research updates here? So, you know drug name, you know action, and what brings the what makes the cough suppresses. Either it should be antitussive, either it should be bronchodilator, right? What makes the drug, the what brings the action of rakta pittagna? There should be contractions of vessels, right? Without contractions of vessels, you can't expect the bleeding to stop. So you know you should know before writing the research subjects. If you have this good knowledge of XYZ concept is good, you should know the drug name, you should know the concept, you should know at least the mechanism. Then you can say according to research. No need to write when and where. According to the recent study of 2010, 2015, Vasa, Aratoda, Vasika, or if you're talking about Tikta Rasa, we'll come to Rasa only, right? We'll talk about Rasa. Tikta Rasa, according to recent studies, Tikta Rasa, bitter taste, has been proved to work as effective as antipyretic drug or antipyretic drugs such as you can say quote paracetamol, such as other drugs. So you know Tikta Rasa is Jwaraguna, right? Tikta Rasa will reduce the Jwara. Tikta Rasa is Pitta Ara. It reduces the Pitta, right? So this is how you can bring up the research updates by combining the clinical knowledge. Make sure in the study you have make sure you write research updates in the study conducted in 2015, 2010. It has been proved that Tikta Rasa is capable of a shown significant results, significant what potent results, significant results with respect to the modern drug in helping in reducing the fever. So this itself become research updates. Just make sure you understand, you know the basic concept. So this research updates, and because nobody will expect you to go and read the research magazines and bring out the same inputs. Make sure just uh, think to make sure you understand the research aspect or well into that. If you follow these research updates for all the questions, this would go good. But make sure you don't not only stick to this. After writing this, you know make sure you start reading the research papers which may help you in upcoming exam. Then conclusions. So long answers questions should come. Introduction, definition, classifications, then the content is expressed in tables, flowchart, diagram, and clinical application, research updates, and try to make sure write conclusions. Similarly, and this is how you should make sure that your notes look like. For short answers also, same introduction, off para, definition, classification, matter, flowchart or diagrams. For short answer, you may not need research updates. Make sure you add clinical application. Adding clinical application will always give you extra marks. And conclusions. This is for prepare. While preparing the notes itself, make sure you prepare like as you're writing exam. Then coming for concept, that we talked about long answer, short answer. So coming for concept, there is no we know that in karma we may get 5 marks question, we may get 10 marks questions. How to prepare notes for this? Whenever you're working on Tripana, Pachana, Grahi, make sure you remember the sloka. If you are a shloka person, if you are good enough to remember the shloka, that's a added advantage. But some students may not be well into shloka. But all should make sure they will get all the shloka, they will remember and they can able to recall all the shloka. But in case you can't recall the sloka in a short period of time, make sure that while writing a definition, use Sanskrit word. What does Deepana does is Agnikara, but not does not do Amapachana, right? It will ignite the kindle the Agni, but it not digest the undigested particle, right? This is the meaning of Deepana. So instead of writing this will kindle the Agni, kindle the digestive fire, make sure you write definition, uses Sanskrit word Deepana. Is a properties of drug which increase this Agni. It is Agnikara and does not do in English. Amapachana should not be in English. It should be in Sanskrit. It should be in the font, the regular font we use, right? If we start using the mixed font for the important paragraphs, this will adds a point, right? Coming up, if you don't know sloka, if you know sloka, that's well and good. If you don't know sloka, make sure you quote the main names. Deepana. Make don't read Deepana. Don't write Deepana in English. Make sure you write Deepana. Make sure you write Pachana. Make sure you write Grahi. Make sure Rasayana, Vajikana. Whatever the Sanskrit word you comes, make sure you bring up Sanskrit words, Sanskrit fonts in your answer paper. This will attracts more marks. Then English meaning. Then make sure flowchart. So we can say like we have Vedana, we have Rechana. There you can see Anulomana. Most of the karmas are aligned, right? Most of the karmas are aligned. But Anulomana does one thing, Vedana does one thing, Rechana does one thing. So always make sure you divide the point, like giving arrow marks. It does Amapachana, it does Amasoshana. Grahi does Pachana as well as Soshana, right? Similarly, then you talk about Guna, then Panchamabhuta, Karma, example, clinical applications, and modern correlations must. If you're talking about Deepana, you should make sure you talk on appetizers. If you're talking about Rechana, Anulomana, make sure you write out laxative at least 2 points. So just note these slides and make sure you prepare the notes of each karma with us. This is one example. Like I can say Anulomana, Krutva Pakam Malana, Yet Bitva Bandamara Nayat. You can see it's action partially found Mala, then give one arrow marks, does the Paka of Apakva Malas, then clears the obstructions. You can see Banda, clears the bandha and helps easy evacuations. Right. Then Panchamabhuta, Prithvi Jala Vayu, Rasa, Guna, Rogagnata, with respect to Rogagnata, their clinical correlations and examples. Don't forget to write examples. The similar way, pharmacology also, make sure you bring up this point: introduction, basic concept, classification, action wise, definition, examples. Here also, as pharmacology is a vast subject and information you got, make sure you bring up in charts. Make sure you bring classification charts. It will definitely help. Mishraka Gana also. Mishraka Gana, if you get uh, what Dashamula, if you get Panchatikta, make sure you remember Shloka. If you don't remember Shloka, no problem. Make sure you clearly know the component of that Vargas. It is 5, 7, 8. Write the name, write the botanical name, family. If you know family, good. If not, no problem. Name in Sanskrit, botanical name, then part use. These are the main thing. You should write it in table as Panchavalkala, right? You should make sure you write the component of 5 botanical name and part is in one table. That table itself assure the evaluator that you know complete details about Panchavalkala and gives you a good marks. And then main karma of each drugs, one on karma, total number of components. Panchavalkala means 5, right? Then make sure you write 5. Then guna. What does Panchavalkala is? Ranaropaka, right? It is the ulcers, it is the wounds. Then stambhaka, it also helps to arrest the bleeding. It also antimicrobial, right? Antibacterial. You can use that things. Then karmas uses. Based on the karmas, if you can correlate, you can get the uses. Clinical application, where does Panchavalkala is used? Panchavalkala is used in or Vrana. That is Vrana Ropaka. You write indication is Vrana. And it's Stambhaka in bleeding disorders. Research updates, as I said, based on the marks allotted, make sure to add research updates or not. So this is about the concept of paper 1. Paper 2, where I will just take 5 minutes to finish this part. How to read drugs. Most of you may say, sir, yes, sir, part 1 we can understand, we can recall, we can remember easy. But the thing we struggle is part 2, drugs. How to study drugs. See, there is no magic, there is no what magic pencils or any other things to make you remember the drugs or herbs or herbal names. Only thing is the main principle, the magic theory is you have to observe, read, observe, revise. So always go out of your college, go out of your place, start observing, start reading. Then once you read Amalaki, once you read Shunti, make sure you observe again. For Shunti, you don't need to go to your garden while eating food, while eating breakfast, while eating ginger tea, while eating masala tea. Feel the presence of Shunti. And once you see the Shunti, once you see the tomato, once you see the other leafy vegetables, you should make sure, oh, at that point only, you should make sure you remember that. Oh, what's the name of Shunti? What's the botanical name of Shunti? Gingipura officinalis. What the family it belongs? What's the important synonyms? Morphology, whether it's herb, shrub, or tree. And what's the main part? Whether a rhizome, whether a root is used. What's the main karma of Shunti? What's the main rasa? So, just by reading, you can't get drugs. Just by observing, you can't get drugs. Observe, read. Again, observe, revise. Only with revision, you'll get to know. So, whenever you're working on botanical name herbs, make sure the points which are in the left are must, whether they ask botanical name or not. Unless you write botanical name and family, the whole answer will be invalid. Okay, make sure you know you got 97 drugs. It's very easier to the less number when compared to older syllabus. Make sure you remember the botanical name, family, synonyms. If you got time, habit at least tree, shrub, earth, main pathways, main karma, minimum 3 karmas, right? Rasa, main rasa, right? Then the next part is dose. What's the dose, formulation, indication, chemical composition, ganas and group. This is the second part, but the first thing is you should make sure you remember this thing. And I got a easy tips. Sir, no sir, like since here like we are reading but still we are forgetting, and we got only couple of weeks for exams, and we are very bad in remembering botanical name. How to do that? How to solve that problem? See, just don't need to go for any tricks. Okay, that's my sincere advice. Don't go for any tricks. Don't go for any mnemonics, whatever you say. Huh? Just make sure you got 97 tracks, right? What I even I when I was a student back then, 10 12 years back, even I have faced that problem. Okay, how I and we and our friends used to resolve that problem. How we used to do. So now I used to carry a small sheet of paper. So now you can see my tissue, right? I used to make this tissue, the piece of paper in this tissue form in 4 ways. So 4 way. Now I got earlier I had one piece of paper with one section, broad section. Now I have 4 sections. Right? If I fold, I can carry all this paper in my pocket, in my wallet, or in my phone, like that. Okay, this is the I divided, categorize this paper in a 4 section. What I used to do, I I had made my mind to remember at least 5 drugs in a day. You can't recall, you can't read, and you can't remember. Or at least you can't even read. Go through 50 drugs in a day. Definitely should not do. Okay. Just make sure at point one, phase one, I'll only remember botanical name and family. One day, how much time it will take to remember one botanical name and family? 5 minutes for one drug? Definitely not. It hardly takes 2 to 3 minutes. You are not a new, right? You might have heard in last 1.5 year, you might have been exposed, experienced the different name. In out of 97 drugs, already 40 50 drugs are familiar to you, right? But make sure it's confirmed, it's fixed. So daily make sure you read 5 drugs. Vasa, Aratoda, Vasica, Acanthaceae family. Shunti, Gingiber officinalis. Amalaki, Emblica officinalis. Pylanthus emblicus. Okay, only names, botanical name, family, nothing else. It hardly takes 15 minutes. I can challenge you. It hardly takes, if you sincerely give focus, it takes only 15 minutes to remember 5 drugs. Just carry this. If you while doing breakfast, just read yes, 5 drugs finished. If it takes 15 minutes to read 5 drugs, tomorrow it takes only 5 minutes to recall. It takes only 5 minutes to recall. Next day, what you should do? Should again continue the same 6, 7, 8, 9, 10. Should add 5 more drugs. 15 more minutes. While recalling, you should make sure you read first 5, then go to next 5. On the second day, you will have got a knowledge of 10 drugs. Here, you're only reading botanical name and family. You're not going to morphology, you're not going to karma, rasa, dose, formulations, anything, right? Just remembering the botanical name, just remember the family will make you feel more good, strong, will make you confident enough to go ahead. Like this, it takes in a 10 days you can cover up 50 drugs. Even if today, by today also, till today, if you don't know any drugs name, any botanical name, try this challenge. Read botanical name and family, nothing else. One botanical name, one drugs, 2 minutes. Daily. Just reading botanical name and adding 555 drugs every day. At one good day, on 10th day, you will be capable of 50 botanical name and family without struggle. But if you sit now, no, I will finish 10 or 50, 20 drugs today itself, definitely it won't come. Even if it go, even if you happen to finish that tomorrow or day after tomorrow, you can't recall. But if you follow this, like cumulative effect, cumulative techniques of bringing things together in a small portions, then you are capable of retaining it for longer period. And there will be no stress. See, once if you know the botanical name family, then you will be confident enough to write next things. About next, after finish, you have finished 50 drugs. What next? Make sure whenever you talk about Vasa, part used. Whenever you talk about Apamarga, part used, Panchangas or Mula. Whenever you talk about Madanaphala, part used, fruits, nuts. Whenever you talk about Amrita Balli, what you use? Kanda, right? So make sure the one word should always be fixed. In textbook, you can get more words, karmas, more words. Make sure at least being in UG, being in second year, going near to exam, three karmas, three system of karmas, one rasa. If you know understand rasa, madhura rasa, you can decode guna. You can also decode all the madhura rasa dravya will end up in madhura vipaka. There are exceptions, right? If you cover up those exceptions, most of the drugs fall under general principles. If the drugs rasa is madhura, you can easily write madhura vipaka. If it is madhura, it should be guru. It should be shita. If it is madhura, then the virya should be shita virya. Then karma tarpaka. So always make sure you remember the three karmas. Always make sure you remember the botanical name, family, rasa. With rasa, you can decode. So understanding the drugs, remembering the drugs itself is a detailed chapter. We can talk it takes a whole time. So if time permits, we can work on only talking about the second part. How to read the drugs, how to understand, how to recall, how to correlate. If time permits in future days, we'll make sure we'll do that program, giving time only to understand the drugs or working on remembering the botanical aspects. So with this, we are ready to go. As I said earlier, you got to know how to read, knowing the field, second part, understanding and revising, importance of revising and making a good notes. So before going to exam, now you have prepared well, you got a good notes of in a such a way that the same can be replicated in exams. The third part, make sure before entering the exam, before taking exam, make sure you take two or three exams yourself. Make sure you sit on a table at least 1 week before. 1 week before exam, make sure you strictly sit on a table with a word question paper or any question paper pattern. The 10 for 4 SAQ, LAQ, 8 SAQs, and 20. And make sure you sit on the table for 3 hours. No nonsense things. Only you should write whether you remember, whether you don't, whether you can write or not. That's a aptitude test. So it makes you strong. There you can analyze your weaknesses. Yes, whether I can sit for 3 hours or not, whether I can finish the questions like within 5 pages or not, whether I can remember that questions or not. That mock exam will give a clear pictures and showcases your weakness so that such mistakes will not happen in the real exam. So students, make sure at least you take 1 or 2 exams. 2 years, no need to ask anybody to give you exam. Just take word question paper instead of randomly solving the question paper. Once you revise all the syllabus, once you finished all the syllabus, make sure you sit on a table on one fine day. Make sure you bring up the atmosphere of exam. 3 hours, put an alarm for 3 hours. You can't get out of the table within 3 hours. Okay, whether you remember not, make sure you experience the exam feeling. By doing this, you'll definitely less stressed. You feel more confident and you'll be more calm in the real exam. I'm talking this with respect to all the subjects, not only with Dravyaguna, all the subjects. Please take mock exams and do correction by yourself. If you correct your mock exam, you can get to know, yeah, this is where I forgot, this is where I went blank, this is where I need to improve. Okay, and don't overread new things. If these things are fine, We can go to last part, the final part, and we can wrap up the exam writing skills. Now we have understood the syllabus. Now we know how to practice. Now we know how to make notes, and we have done a very good practice. And we also done the mock exams. So, what's the third section's goal? In exams, the main goal is to attend all the questions, whether you know or not. It's not that you're not read Dravyaguna subjects only. It's not that you're new to subjects. You know everything. Huh? Make sure you attend all the questions without leaving anyone. Right? Plan before writing. That's the most important thing. Think before ink. Right? Always use good pen, clear handwriting. If your handwriting is not good, if your handwriting is not fair, clear enough, then there's high chances of losing the marks. How to do this? You can't improve handwriting in 1 or 2 days. Even my handwriting was not good enough during that day. The good advantage of good handwriting people is they'll get obviously good marks because of their good handwriting, good spacing. But if you are one student, kind of students like me, who are not have, doesn't have good handwriting, make sure you give good spaces between each words, good space between each sentences. So the only thing is all the evaluator will not read each lines. Okay, they will just pick a line, pick a word. If such words are there, things are good to go. If they can't find such words, whole thing is into. So make sure whenever you are using giving a paragraph, make sure to highlight the important words. Write the important Sanskrit terms or underline it. If he or she finds that word, then you will get good marks. If not, even if you write 10 paragraphs, no use. So even if you don't have a good handwriting, make sure giving a clear pictures, clear spaces, and using flow charts. Using flow charts and tables will help you to compensate with your uh, handwriting issues. And make sure always underline, as I said, systematic approach. Make sure whatever you write, everything is systematic from definition to conclusion, from classification to content, from highlights to clinical applications. So common mistakes student do in exam, right? As you know, like everything, you have read the subject very good, you read the rasa very good. The first question itself is of rasa, and you said, "I know everything. I will start writing." No, writing everything you know is not a good thing. You should always be specific. What I've asked, giving a background is a good thing, but don't overwrite. And without heading, in the writing pattern, you skip the heading and no structures. Just going with the paragraphs. Make sure you use bullet points. Don't write long paragraphs. No one is there to read your paragraphs. There is no one to read your story. Okay, just stick to the point. Use bullet points. That also bring gives more space and also give a good picture. Right? Time management. I will talk about time management in last. And ignoring MCQs. And in a brief, we can say that Dravaguna exam is not about mugging up and replicating that in a sheets. It's always the ability to think, classify, correlate, present. That's what I said. Definition, classification, clinical applications, and research updates. It's based on how do you think and how do you present. Right? It should give your question paper or your answer paper should make sure it gives good clarity to evaluator. This person, this student has read. This student's got good knowledge. And with the how you can do it with the proper structure, with neat presentation, logical flow, and adding Sanskrit word will give classical authenticity. That's what an Ayurveda student must have. Okay. Now coming for the exam pattern, you almost know like 10 marks. You get 10 marks LAQs questions which are in 4 in number, which covers 40 marks. 5 marks questions which are in 8 gives 80 marks, and 1 marks question MCQs for 20 and 20 marks. The whole question paper is divided into 40, 80, 20. And how to work on space management. As you already aware, you have written the exams. For 10 marks, you can use 5 to 6 pages. The short answers, you can use 3 pages, and 20 MCQs, 10 in 2 lines. Just mention the number of that question the option name A as ABC, and make sure don't leave only option name. Write the answer too. If say Pasa is a drug of choice for what? If they got Brahma, if they got Jvaragna, if there is got Shula, then Rakta Pittagna, option D should write option D. Question number 23. Answer option D, Rakta Pittagna. Make sure you mention option number as well as the answer. This will give a clear picture. Okay. And 10 marks question, how much lines to shoot it, as I said, during the notes preparation only, make sure you prepare a notes such a way that it can come for 5 to 6 pages. It doesn't mean for 10 marks you should always write 6 page answers. So that you will put on story, you come up with nonsense things, or you come up with elaborate the same things. Definitely not. Make sure even if you write 5 marks, 5 pages is enough. No need of writing for 6 pages, because the marks is for 10. Nobody will give you 10 marks. Even if you write 6 marks, 6 pages of information, fill the pages of 6 marks. uh, the marks is not depend on the volume you put. The marks is depend on the quality you write there, quality you put there. So always make sure the goal is not to fill the 6 pages. Even if you fill the 6 pages, you will not got 10 marks. Okay. Make sure you involve flowcharts, tables, and make that to bring the volume. If you can finish the line in 2 3 lines. If you bring a flowchart, it can acquire 7 to 8 lines. The paragraph which can finish within 3 lines, if you come up in table, it can take 8 lines. It depends on how you present, right? If you bring up in diagram, it may take a half page also. That's what this is called, systematically filling the pages, increasing the volume with respect to quality, not only quantity. Just by putting paragraphs doesn't help. Make sure if there's one diagram, one table, one flow chart, you'll get minimum good marks. The goal is not to fill 6 pages. Make sure even if you write 5 pages, 4 pages, just make sure you bring definition to conclusion, definition to research update. Similarly, the same apply to 5 marks SAQs. Make sure to start with definition, ends up in clinical research. And as I said, this previously this slides has been displayed. For long answered question, this should be your pattern, and short answered question, this should be pattern. This itself can able to give a good volume of 5 pages and volume of 3 pages. And exam writing skills, time management. As I said, without time management, nothing can be done. Even if you keep on writing the good things, and if you get blank out, if you're be stuck at the same point, same question, things won't help you. Always make sure you're a good time manager, and then you give more respect. Okay. Briefly, if you working on time, right? Working on time, you can make sure we get 3 hours of time, where make sure the first 5 minutes should always read the paper. Dedicate the first 5 minutes to understand the paper, question paper. The last 5 minutes for decorating the paper, for underlining the important points, by giving the lines. Use always take pen, paper, pen, pencil, and scales. Make sure you lined it around every, whether the page ends or not. Make sure you line all the at the end of each answers. The first 5 minutes for reading the questions, last 5 minutes for underlining, decorating. The rest part for 10 marks LAQs, which can be able to fill for 6 pages, make sure you only give 15 marks, 15 minutes. Whether you know the answer, whether you don't know the answer, the dedicated time for 10 marks LAQs only 15 minutes. You start from definition, make sure once after 15 minutes, don't waste time, don't drag it. Okay, make sure the goal is to answer all the questions. Okay, after 15 minutes, just go to next questions. Go to question number 2, question number 3, question number 4, whatever question you know. Just 5, 6, 7. Make sure you don't spend more than 15 minutes for one question at that moment of time. More than 10 minutes for SAQs. Okay, more than 10 to 15 minutes, 1 minute for one MCQ. Some can be finished in 30. So 10 to finish 15 minute for MCQs. Okay, always start with the pattern. Also, just follow the same pattern of question paper. Dedicate the starting pages for LAQs, then to SAQs, last MCQs. Okay, if you're good at MCQs, make sure you fill up the 49 and 58 page, the last page, first MCQ. So, okay. Then you can come for the question of your choices. But make sure you don't spend more than 15 minutes of time for LAQs, 10 minutes of time for SAQs. Okay. So the total hours, writing hours will be 10, 2 hours, 30 minutes. If you divide, right, the total hour will be. So in that, 5 minutes you are spending in understanding the question paper, reading the question paper, scanning the question paper. Last 5 minutes is compulsory for lines, underlying, fill in the blanks. Okay. So rest you will get 20 minutes, right? The rest 20 minutes, what we should do, right? If we start by 10, we'll finish by 11:30. 10, 11:30, or 9, whatever time you get, 9, 10, 11:30. So the rest half an hour, make sure on the first part, when you're when you're moved out of the questions on 15 minutes, make sure you come back and give 1 or 2 minutes to conclude that. Write a conclusion. Dedicate 2 minutes for 10 marks questions, 1 minute for 5 marks questions. By that, you can completely utilize your 3 hour questions in a beautiful way, in a well formatted way. By following this, there will be no stress, and also, even if you skipped, even if there is more one page left for only 4.5, 5 pages left for LAQs, you will get a good marks. Huh? Getting 1 mark lesser is better than skipping a whole question. Should not so over involving the same question and losing time for writing a questions you know. So make sure you dedicate the time properly. Right? Take home message: be calm, always use Sanskrit words, use highlights, maintain systematic way, definition, background, flowchart, tables, clear concept, and don't overthink and don't overwrite. Okay, even if you don't know, bring up the concept you know, the previous background, and try to cover up things. As the session is at the end point, don't forget the rule of before going to any exam, not respect to Dravaguna, understand the syllabus, prepare rightly, think before ink. I think we are good to go. If you got any questions, I think Karthik can help with connecting us. And if you got more informations, you can give a greater hint from you can get a greater hint from us. I'm Dr. Manju Prasad. I'm an international Ayurveda coach. We're already into subjects, helping students to learn the subjects in a better way, in a practical way, whether it's Dravyaguna, Rashastra, or any other subjects. We are here, our team is here to make your learning journey easier and simpler and effective. You can always feel free to reach us at Ayush Solutions Academy of Learning for coaching support for Ayurveda subjects, and WhatsApp number is there. And thank you. Feel free to approach. If you got any questions, I would like to answer any questions to Karthik. Thank you.
Sir, thank you so much, sir. It was really a wonderful session. The messages are pouring in already. Usually we hardly get messages during session, but many are already texting that session is going very good.
I hope session was
And
helpful. Like we can, yes, the concept is so like in detail. As I said, part two can we can discuss a part two in detail with completely different sessions. So I hope
yeah,
the students are getting more problem with part two only. I just briefed as
yeah.
much as possible because already we are running out of time. We've already extended my talk for 20 minutes. I hope
No, sir,
it works.
not 20 minutes. It's more than 45 minutes.
Okay.
Yeah, sir. But you started from the basics and you went on explaining everything in detail, how to present, which topics to focus on, and how to answer each question, what a student should not leave out, and everything. I think that's what the students need. Sir, I know you have already we have already exceeded the time limit you mentioned in the beginning.
Yes. Yes. Tell me.
So we are more than 45 minutes into the session. But can we take 2 to 3 questions?
Yes. Yes. We can definitely.
Yes, sir. Thank you. So the first question we have is, sir, what the points should be remembered for drugs? I think
No.
you describe it throughout the
Yeah, that
session.
question. Yes. No, I can like streamline here. See, as I said, like as already presented in the slide, the first thing. if any drugs comes to your mind, if you start reading any drugs, just don't think that you were reading a new subjects, because the most of the drugs in 97 drugs, either 20 30 drugs or the herbs, you'll always be daily, you will be in touch, whether it can come for tulsi, it can karanja, it can come for nimba, right? Whenever you see drugs, as I said, make sure the first thing you should get is botanical name. The botanical name will gives a authenticity. Oh, this guy knows that. I got good authentic knowledge. So how to study the botanical name? Remember, use the formula which I told. Just five drugs in a day, only botanical name and family. Okay, at one point, at one phase, you got botanical name. That's good. Second part, then what's the main karma? So why Nimba is used? Nimba is antibacterial. Why is Trivrit is used? Trivrit Virechaka. You know, answer, like the main karma. Why Kutaja is used? It's Kushtagna. Right? Kadira is Kushtagna. Kadira. Right? This is for skin conditions. The second part solve. First you know name. First you know Ayurveda name. Second botanical name. Then you got to know karma. Right? Then you should know. Okay, this Kadira is a Kushtagna. Which part is used? Right? Whether in Kadira we are we using leaf, whether are we using stem or are we using Sara. In Kadira we use Sara, right? Like R2. So first start with botanical name, then directly go to karma, then part use, then coming up with clinical correlations. If you are looking for karmas, it is kushtagna. Of course, the clinical indication will be kushta. See, first you remember, only kushta. For examination, kadira is kushtagna, But you got 5 marks question. How to write that? How to write the clinical indications? So you can correlate that. You can go back in. What is kushta? Is Dvak Vikara, right? This is skin condition. If the Kadira is acting on Kushta, the high grade, the more complicated disease pathology related conditions, it will definitely open other skin disorders also. So you can write Dadru, you can write uh, what other Kota, you can also write other skin issues, as eczematic conditions, you can write other discoloration, melasma conditions, you can bring up like that. If one drug is working on GA system, you can write all Admana, all Ajirna, or what we can say, all Shula, like that. If one drug is working for Shula, you can write Ujana Shula, Sandhi Shula, Bahu Shula, in Shira Shula, like that. Just understand the main functions and try to bring out the disorders in that system. So this will, by understanding the drugs in this line, will not give you more stress. So by this simple understanding, you will almost can cover almost 5 points. With these 5 points, we can easily elaborate in the answer sheet. You will definitely are capable of filling the sheet for two pages. So this is how we should understand. After understanding this, if you can start reading the drug again, then the further, whether it belong to which kana, varga, dosage forms, everything will be easier. And there are very few drugs which have got different correlations and doses. ST should make sure ST dosage is very less. If come for most of the drug doses will be a similar what in a equal way only. If you remember one drug, except giving the exceptional drugs, most of the drugs doses will be same. This is how you have to correlate. It's not that one to another that you are reading a complete different concept. Only few concepts are different. Most of them are in aligned with fundamentals. Yes, I hope I've answered that.
Yes, sir. The next question we have is, sir, can we write botanical name family Rasapanchaka part used as per book and remaining points in general like morphology, dosha, karma, rogagnata?
Definitely. See, this is the as I said, nobody is testing the Dravaguna textbook knowledge here. Whether you read Jalen Shastri, whether you XYZ person drugs, you don't need to replicate that. Just understand the concept. As I said, if you know the system, but at least you should know the classical indications of at least 3 points. Classical karmas. The three main karmas, the major pharmacological aspects. See, if the question is general, you can cover up the morphological aspect in easier way. But there are some drugs which are specially given importance for the morphology. One that is Shatavari, right? Shatavari, one such is ginger, what Shunti, huh? What we Vishwa Besija, what we call. There are certain drugs, there are certain herbs where we give more importance for morphological characters. Just try to pick such drugs and make sure you are good at understanding or writing such morphological features. Rest apart, you can cover up because you can have lively seen the drugs, whether the leaves are parallel, whether the leaves are opposite, whether it's a compound leaves or simple leaf, you will come for roots, tap root, fibrous root, like that. It doesn't mean to always replicate the textual knowledge. If you know botanical name, family, Rasapanchaka and Patus, one or two clinical indications, rest apart, you can definitely make it with your empathy.
Sir, the next question. Sir, how many Hamayika Prayoga have to be learned?
Mm. See, what does Amaika Prayoga means? Amaika Prayoga means using a drug singularly. Right? If you're using Amritaballi, or if you're using ST, where and when that drugs with the use in a simple formulations. Yeah, if you add about Panchavida Kashaya Kalpana, you all know this, Svarasa, Kalka, Kashaya, Panta, Ima, right? That itself is Amayaka Prayoga. If the question directly asked for Amayaka Prayoga, then you have to write in detail. But you don't get Amayaka Prayoga exclusive questions. The always Amayaka Prayoga will be matched up. Just split. If Amayaka Prayoga is asked in 5 marks question with respect to other, split 3 points, 2 marks, 2 marks, 2 marks. If they ask about talk about Amayaka described ST dosage form, it's given formulations Namayaka Prayoga. Then make sure the whole concept, the whole question has been divided for three sections. One for basic, 2 marks, other part 2 marks for content, and 1 marks for Amayaka. Based on that, you can write. With 3 to 5 Amayaka Prayoga is more than good. And you won't be getting a direct Amayaka Prayoga questions. And Amayaka Prayoga means if you remember Panchavida Kashaya Kalpana, that itself is Amayaka Prayoga. Tulsi, Tulsi Swarasa used in Kasa. Okay. And Tulsi Kalka, second part. Tulsi Kalka with Ani is given for Kanta Shoksha. Third part. Tulsi Kashaya will given in other condition. We can also say Shula, Amapachana. Ima, Tulsi Ima or other part. Ima and Panta are mostly used for the drugs which are rich with volatile content. For such, you can use imine Fanta formulations. So if you remember or if you can correlate Panchabida Kasha Kalpana, Amayaka Prayoga will not be a what problematic for you. Rest, you just have to write which form they are taking. Amayaka Prayoga means easier form. So Panchabida Kashaya, Swarasa, Kalka, Kashaya, Ima Fanta. 5 point indications. That's all. Give it Malki. Ashwagandha with Kshira, Nidrajanaka. Ashwagandha with Kshira, Sita, Vajikaraka, Shukrakara, like that. Just have to blend the yukti here. Amayika Prayoga is not much complicated. I hope it made sense.
Yes, sir. I think you have described this in the session. So, how to write
Keep it.
research updates.
Just to
Yeah.
write research updates, make sure you have a good understanding what you write. Bring up no need, as I said, you must read research magazines, research articles. But if you're not, but you have to face the answer questions, make sure you got good knowledge, write a drug name. But main thing, if you want to talk on research updates for particular drugs, the three things you should do: drug name, classical karma, modern correlations. If it is Kasa, Vasa, as I said, I'll take the same example for easier understanding. If you know, if the question is, if you're about to write for research updates on Vasa, you know drug Vasa, Sanskrit name, you know botanical name, Aratoda Vasika, you know indication, Kasa, you know modern correlation is for cough. Okay, research updates is bridging. So in previous research done in particular XYZ colleges, XYZ university at XYZ date, it shows Vasa is capable of reducing the kasa, means cough, by how does the cough elevate? Either we need to get antitussive action or bronchodilatory actions. We take spasa or asthmatic conditions where bronchoconstrictions happen, we need bronchodilatory functions. So we write Vasa is proven to be effective in asthma. Vasa is proven to be effective in swasa because of its what? Kasara, Vasara, what property? Bronchodilatory property. It's just research updates means just switching, connecting all the three aspects, and no one will go and check there. Okay, this to either 2019 whether this research had happened in Kerala, Karnataka, or Bangalore, or Madhya Pradesh. But it's just a orientation for you people to encourage you to read research aspects. Okay, but you should know basic concept to connect.
Sir, how to remember the pharmacology classification? What are the important drugs?
See, there is no drugs which shows it is important or not. Just go with basic pharmacological terms. Make sure basic classification. If you compare, you always got right. CNS drugs acting on the respiratory system, drugs acting on GS system. So whenever you read the drugs acting on CNS system, make sure you know classification. No need to know the name also. Initial level drugs acting on CNS. One arrow mark should go to CNS stimulant. The one which stimulant. The one should come for CMS depressant. Again, you will get further classification. Make sure you have a whether you read or not. Make sure you analyze a complete chart. You can easily get that chart for all the drugs in Google. Simple way. Always refer modern pharmacology book, modern textbooks. Don't go for a chat GPT or any AI designs. Right? Please go refer modern pharmacology books where all drugs system of drugs will be summarized in one table. If you remember that table, that is good enough. You should have remembered all the names, all the functions. Remember the table, remember classification, so that is good. Please refer to pharmacology textbooks.
Sir, is it writing a mode of action is necessary? If so, on what basis we can write the mode of action of drugs?
No, to write a mode of action, you should definitely have a good knowledge of drugs and Usasa Panchaka. Without knowing, we can't bring up mode of action without logical, only with logical interventions. Good without a background of drugs, we can't do.
Sir, final one last question.
Okay.
In the two papers, in the paper one and paper two, on in which paper the student should focus more on scoring highest marks so that it will compensate for the another paper, other paper.
No. Okay. See, the background is all the examination curriculum are well designed, considering the student mindset for all three degree mindset. It doesn't mean only you have to work on paper one or paper two. If you work as paper one is full of theory, I'm good at biting, I'm good at recalling. Paper one is good, and paper two is more of logical, scientific, or like new words. I can skip. It's not like that. Being a student, being an upcoming doctor, Dravaguna is one subject. You should love that because without Dravaguna, without Dravya, we can't practice, we can't lead. Okay, regardless, regard all of this, regardless of that, considering the exam point of this, and considering a student under stress, so the scoring part can be considered from first part. But for all the papers, you should make sure you'll get 50 marks, right? Even if one paper in paper one you'll get 80 marks and paper two you get 49 marks, it's always fail. Make sure you balance. Make sure you see it's not paper one is different, paper two is not like that. Paper one and paper two is completely correlationable. Paper one helps you to understand the concept. If you're good at concept, you can correlate with paper two, the dravyas. So with coming back to basic questions, paper one will help you to get more marks. You can come up with considering the not for passing purpose, considering the overall marks, overall uh, year marks. Paper one will definitely help. Paper two is more of systematic and more of uh, thinking things. The multiple you have to remember multiple way, but make sure you prepare well for both the exams and deliver well. The score is not 51. If you score 70, and you will get 50. And the good thing is, if you write 10, if you think I wrote 6 marks, 6 pages for 10 marks question, and 3 pages for 5 marks question, this doesn't mean you will get 10 marks. Okay, hardly in a practical way, the way you write, the way you describe, the way you express, and the evaluator you get, and it's based mainly on computer based evaluation. No one will get physical copy of your paper, right? So it will be scanned. Only if you write legitimately with a good space, a reader can read the screen. Okay, if the good hindsight. If there's a problem, if there is any issues there, there's high chances if you just go with paragraphs, doesn't work. Always use bullet points. Focus more on both. Being a coach, there's no discrimination. Talking with respect to exam point of view with student mindset, paper one would give more marks, and paper two you can compensate, but make sure you work more for paper two. And the second part, the apart from Dravyaguna or any exam, after completion of exam after 12 o'clock, forget the previous paper. What you read, when you how you read. Just make sure where you fell, what were your shortfall, how to not to repeat that in the coming pages. And once whether you do the paper in a good way or a bad way or a worst way, don't carry that mindset, don't carry that feeling or thoughts or that aura affect your second paper. This is my one of the good advice for all the subjects. So paper one gives good marks. Paper two is also as much as important. Paper one. I think Panchajanya is on mute.
Yes, sir. One last question we'll take, sir, and we will end. Sir, what
Yes.
and the question is, what and all should be written in Dashaimani Gana Karmas for 5 marks?
Okay. See, if they ask Dipanya Dashamani, the first thing is you should write a background. So Charaka Dashamani, why Dashamani has been described? 2 lines. Second part, Dipanya Dashamani. Number of drugs mentioned in Dipanya Dashamani. 10. 10 drugs. Make sure if you are good enough to remember the botanical name, write botanical name. Then parts. One you should write number of components, number of drugs. Of course, 10 drugs, 10 Dipanya drugs. Then botanical name, part use, and then guna karmas. If the drug has to act as Dipaniya, whether if the drug wants to act as Vamana, or Vamaka, what the drug should have? The Pancha Bhautika Tattva. The drug should be rich with Agni Tattva. If the drug should act as Tambaka, then drug should be rich with Shita Viraguna. Write that part. Then give examples, correlations. This is where we can use that drugs like that.
Kammido,
So
Misa,
definition,
ಒಂದು ಲೋಟ ಇಡು.
definition, background,
ಉಳ್ಸ್ಕೊಳೋದ್
number
ಬೇಡ.
of content, name, parts, gunakarma, clinical application, where Dashapana is indicated. Dashamana is indicated in Admana. Dashamana is indicated in Ama situation. Dashamana is indicated in Agni Daurbalya, like that. And research updates. According to recent studies, it has been found that drugs in Dashamani is as effective as appetizers, as effective as increasing gastric secretions, like that. You can add up things like that. For everything, start with background, definition, ends with conclusions. In middle, always use tables. This itself is good for 5 marks.
Uh, Thank you, sir. That would be all from the Q&A session. And really sorry for the disturbance in the end. I forgot to
No,
mute the mic.
not an issue.
Yeah. Sir, it was really, really a wonderful session. And I think all the doubts of the students are solved. If there are any, if the students convey us their doubts, we will get back to you, sir. I will
Definitely.
reach you out to get answers from you, and um, then forward the same answers to them. And I've got so many messages, not just me, my team members have also got messages that this session has been really insightful, and the students enjoyed the session throughout, because it started from basics. It just didn't start on how to write the exam, how to present the paper. There was no imposement like you should do this, you should do this. It wasn't like that. The session was more of like stretchable thing, like you can also do this, if not you can also do this. So it was more like a mix and match of yukti
Yes,
and
yes, what you
knowledge.
said is correct. Because uh, we try to reach, we follow Charaka principle. So
Yes,
our thoughts should reach all kinds of students, right? And even
yes,
then, I'm not telling we are agra, like we are also, we learned, we failed, we learned, and we revised. That's how like we understood. Like this is how uh, we will learn. Everybody will learn.
Yeah, and I also got a quick recap of Dravyaguna,
Yes.
and very impressed by the amount of knowledge you possess, sir, because answering outright what we see nowadays is bit different from how you taught the students, sir. We see more of like PPT based lectures and all, and the way you want answered all the questions spontaneously, the way you used your knowledge to give examples for the students, like how to do this amayika prayoga and all. It is very general examples where we as students tend to forget while writing the answers. You showed the method how to use all the things that happen in our life, day to day life, in general application and get the marks. That's a very beautiful concept, sir. So thank you from all of us at Panchajanya for
Thank you.
accepting, and we are really grateful, sir. Thanks for joining us in doing a service for the students. This Ayurveda community is really lucky to have some people like you who work for the students, um, who are always ready despite your busy schedule, sir, because you are now running business as you are owner of two companies. So it's not easy for someone to make time in such schedules. So really thank you, sir. We are really grateful, and we will be having more collaborations and partnerships and anything possible with you in future, sir, as an
Definitely,
organization. And
definitely.
personally myself, I have seen and known you from years. I know how humble and down to earth you are, sir. So I think we as students can get a lot from you. So thank you, sir. Thank you so much for joining today, and we look forward for
Thank
more
you.
such
Thank you.
collaborations in the future.
Definitely, definitely. Let's look forward to collaborate Panchajana in future. Thank you. Thank you for giving him a platform to reach to connect with the students. The, the best
It
thing
was,
I always do. Thank you.
it was our
Namaste.
pleasure, sir. Thank you. Thank you so much, sir.
Thank you.
That will be
Namaste.
all.